Welcome! In this video, we'll cover everything you need to know about splints, their definition, various types, uses, and essential patient care. What exactly is a splint? It's a medical device used to immobilize and protect an injured limb or spine, often made of rigid materials like plaster or metal with added padding. While both splints and casts immobilize injuries, there are critical differences between them that affect their use. A cast completely encloses the limb in a solid structure, but a splint only partially encloses it and is secured with straps, meaning it's field attachable by EMTs. A major difference is adjustability. Splints can be adjusted as swelling changes, whereas casts cannot. Also, splints take a short time to apply, unlike casts. When should you use a splint, and when should you absolutely avoid it? Let's look at the indications and contraindications. Splints are indicated for common injuries like fractures, sprains, and dislocations, as well as joint infections and acute conditions like arthritis or gout. Avoid using splints when dealing with compartment syndrome or infected skin conditions, as this poses a high risk of worsening the infection. Splints are created from various materials, including plaster of Paris, Kramer wire, fiberglass, and specialized prefabricated options. Plaster of Paris, or POP, is calcium sulfate dihydrate. When wet, it releases heat in an exothermic reaction, setting in just 3 to 9 minutes. Other materials include Kramer wire, fiberglass, and air or vacuum splints. Air splints inflate to become rigid, while vacuum splints extract air to mold around the injury. Let's explore some of the specific splints designed for particular injuries or needs. The Kramer wire splint is bendable for quick transport. The Böhler-Braun splint utilizes pulleys for traction to prevent foot drop. The Dennis Brown splint uses adjustable shoes on a bar to treat clubfoot, while the cock-up splint is specifically used for radial nerve palsy. The aeroplane splint holds the arm abducted for injuries like brachial plexus injuries. The SOMI brace is a cervical brace that allows patients to lie flat. Proper care is essential to prevent complications for patients wearing a splint. Always ensure proper padding at the fracture site and bony areas. Also, elevate the encased limb to help reduce swelling. Encourage active mobilization of muscles and joints, particularly fingers and toes, to maintain function and promote healing. Finally, regularly monitor for signs of nerve or vessel compression and check pressure points to ensure the splint isn't causing further issues.